An NG, or a nasogastric tube, is a tube which is inserted through the nose. The distal end sits in the stomach, where it usually is put on suction and serves to evacuate the stomach, to remove the stomach contents. And sometimes it can be used to deliver nutrition to the stomach or medications to the stomach. LR, or lactated ringers, is something you see commonly hanging from a pole in a surgical ward. It's also known as Ringer's lactate, and it's a crystalloid solution whose components are very similar to blood serum, and it's used commonly in surgical patients for volume restoration in patients who have blood loss or suspected blood loss. The PICC line is a peripherally inserted central venous catheter. These are usually put in an arm vein. They are long, thin catheters whose distal tip are somewhere in a central vein, such as the superior vena cava, and they're used for delivering medications and nutrition, and they are more durable than the short venous catheters we commonly use in the arm and hand. They last longer than the short catheters, and they also have a lower infection risk than shorter catheters commonly used as central venous access, such as subclavian or IJ or groin lines. TPN, or total parenteral nutrition, is a source of nutrition for patients unable to be fed through their intestine. You'll see it hanging on the surgery wards in a bag and being delivered intravenously to patients who can't receive nutrition by gut. The Dobhoff is a nasoenteric feeding tube. The tube's introduced through the nose, and the distal end sits in the duodenum. The patient is fed from a bag of hanging liquid food. The food bypasses the stomach. The JP, or Jackson Pratt, is a closed suction drain system for evacuating fluid. The drain usually sits in an operative space and exits the abdomen and is connected to a compressible bulb which maintains negative pressure.